Good afternoon, everyone. I'm Emily Burton, registered nurse with Mountain Pacific. We want to welcome you to another week of It's Worth a Shot. This week, we're going to revisit battling burnout and learn more about the CDC updates on vaccination recommendations with our own Kyla Newland here. Next slide, please. So we're going to go ahead and continue this series each Wednesday. We invite you to utilize the chat function or email your Mountain Pacific contact if you have any ideas for topics or you have a best practice that you would like to share as a partner spotlight presenter. Next slide, please. We didn't have any follow-up Q&A from last week, but we did want to have a little discussion about the DEA National Prescription Drug Take Back Day before we get started today. It is this Saturday, April 30th. Now's the time to ensure your facility's policies, disposal practices are aligning with the most current recommendations. As you know, proper management of medication disposal is directly related to our diversion risks in our communities. A proactive approach to managing discontinued medications can really help prevent diversion, support public safety, general regulatory compliance, and our wellness. We have compiled a list of resources, so if you're interested or you have any questions, again, please go ahead and reach out and chat, and one of our team members would be happy to go ahead and send that to you. Next slide, please. In February, we briefly explored battling burnout, and I had the honor of being with you for that. And because burnout is still rampant through our healthcare system post-pandemic, we really wanted to revisit this topic with all of you. In our limited time today, we're not going to solve all of the issues surrounding burnout in healthcare and nursing homes. However, my hope is that you can take one or two key takeaways that inspire culture growth within your facility. My preference was to have had the time and ability to do breakout rooms where we could have some really interactive discussion. However, just with the time constraints, we're not going to be able to do that today. But I do encourage you to go ahead and turn your cameras on if you want to come off mute, if you have a comment, or chat in if you have implemented any programs that have been really instrumental in improving your workplace culture. I would love to hear about them and make this interactive. So as COVID numbers have tapered off over the last few months, it's offered us an opportunity to really reflect and review lessons learned over the last 2 years and begin to explore how we reimagine our care and our culture utilizing lessons learned from the pandemic. So that being said, although I can't pull you into more discussion today, I do have a couple of polling questions today. Mary, if you wouldn't mind launching that first polling question. So what I'd like to know is, what is one intervention that you've implemented from lessons learned from the pandemic to improve the culture for your staff? And we'll just give it a...
Hold on, Emily.
Yeah, I was going to say, it looks like it ended.
Earlier.
Yeah.
It's not working.
Let me know, Mary, when you think it's ready.
Okay, I think it's ready.
Okay.
We see it?
Yep, I can. Hopefully everybody else can as well. And if you guys want to go ahead and pop in what you've been able to implement in your facilities, that would be great. I wish I had some Jeopardy music to play in the background right now. We'll give it just a few more seconds here as we see a few more people participating. All right, Mary, I think we can go ahead and end the poll there. So it looks like the top two here are employee retention incentives and wellness incentives or initiatives for staff. So that's great. Lots of different opportunities available. So with that, we'll go ahead and go to the next slide, please, Mary. You've probably all heard the term the Great Resignation, and unfortunately, we're continuing to see healthcare workers resign at alarming rates across the country. Many have said that the pandemic may have been the final straw for healthcare workers. However, the resignation's really been looming on the horizon of healthcare for years. The top reasons we see people leaving healthcare and why they report is burnout is the high stress, low pay, childcare issues, lack of advancement opportunities, and lack of respect. And although we may have little control over some of these reasons for the resignations, we may have some solutions through creative partnerships within our communities, such as daycares and that type of thing. We hear all the buzzwords: burnout, resiliency, wellness. And unfortunately, for many healthcare workers right now, that's instead of instilling that hope and opportunity, those terms are really triggering more of a negative emotion. There's lots of national and local focus groups really researching this topic with no easy answers or one-size-fits-all solutions. The key to really any improvement is to start something that makes sense for your facility. So today I want to talk a little bit more about focusing on less talking and what's being done nationally about burnout and defining some more actionable steps that might work in your workplace culture. Next slide, please. So how do we go about creating connections and improving engagement? When we redesign the culture in our facilities, we can provide opportunities and resources in some of the following areas: with career growth, health and well-being, retention being the new recruitment, training programs, continuing education, rebranding as a facility, and engaging the staff in committee and policy work. Looking at some of these examples of actionable interventions you may use in your facility, starting with an assessment or survey of where your staff is really at is a great place to start. Instead of just trying to start with interventions and may not even be applicable to your staff, really understanding where they're coming from. Knowing what your pain points are with your team, it's easier to implement meaningful interventions in our workplace that are sustainable. Open communication and leadership buy-in for the investment in wellness and culture is essential for the sustainability and the success of these types of improvements. You know, the catchphrase, the retention is new recruitment, can really be a powerful change in our mindset and how we're treating our staff. How are we taking care of our people? When talking to your finance team from the business perspective, it's really helpful to compile data around the cost of recruiting and training new employees versus the cost of retaining those great employees that you already have. Creating time and opportunities for meaningful connections with your employees and asking them, what's your goal in life professionally? Why is that your goal? And how can we help with your growth and development towards these goals? You know, often a facility may have resources and connections to help chart a career path for employees that they may not have on their own. It may also create an opportunity for the facility to develop career pathways, training programs, and continuing education. Even if that career eventually is going to take that employee away from the facility to chase their dream job, taking the time to really connect with your staff to show has shown improvement in productivity and loyalty. And as long as they do decide to stay there, they feel valued and heard. Another benefit of getting to know your staff's passions, talents, and goals is that you may be able to enhance not only your workplace culture, but the experience of your residents by encouraging your staff to share lesser known talents. For example, you might have a CNA that, you know, is an artist, and maybe they can help participate with the recreational activities, or somebody has a passion in cooking that, you know, if you have a shortage in the kitchen, maybe they can step in and help. So there's a lot of untapped potential in our staff that we have that maybe not tied to their job duties as hired, but they might be able to really highlight and help improve the culture. Another area that maximizes value, talents, and input of employees at every level of the organization is including a representative from each area, from the kitchen to CNAs, nurses, leadership, in committee and policy work. You know, so that we're not making changes that affect somebody's job duty that aren't reasonable or manageable. And there's better improvement in buy-in and adherence to new policies and procedures when people from every level are involved with those decisions. With more healthcare workers leaving the profession, recruiting and hiring is more difficult than ever before. Really reviewing your process for recruitment and onboarding, looking for opportunities to streamline, to ensure that you're not losing potential staff due to the extensive or inefficient hiring process by taking too long or it being a cumbersome process. You don't want to lose a good candidate. There's apps and services. There's one in particular that's specific to nursing homes and hiring staff that can be cost effective and really assist with the whole process, even down to tracking when existing employees even are due for vaccinations. So finally, when we're looking at creating a culture of well-being for your workplace and staff, it's really imperative for leadership to model the wellness in their own lives. Normalizing the use of wellness services and clearly displaying what services are available, and even more importantly, how to access those services, because oftentimes people haven't ever utilized a counseling service before or something like that. And it can be daunting and intimidating to initiate and ask for those services. I've listened to many, many hours on webinars and podcasts on this topic. And recently I listened to a discussion around defining work-life balance. I've heard others say it really should be a life-work balance, kind of switching it around. However, a different view and mindset really hit home that I heard the other day. And it talked about reframing our mindset from a balance to a work-life connection. And that really helps us be mindful and present wherever we are at the moment, instead of pitting the two worlds against each other. Because oftentimes we may have to be more dedicated to the workplace, or we might have something going on at home that takes us. And so when we can be mindful and be present where we are in the moment, it really helps us thrive in every area of our lives, in our wellness, instead of the constant guilt and the struggle to create that balance in our lives. It can be helpful to practice mindfulness and really create a routine of transition from home to work and work to home. Some examples can be a short walk around the block before you get in your car to go home. Some have, filled their water bottles up as kind of like a symbolic filling yourself up before you head home. Clocking out, visualization. And then I had a social worker I worked with that used to get in her car, and whether it was on the way home or work, she would put her hands on the steering wheel and just say, be where your hands are. So just a reminder of being very present. I'd like to leave you with a resource founded by the ANA called the Wellbeing Initiative. In response to the moral distress on nurses throughout the United States, the American Nurses Foundation, which is a part of ANA, launched this initiative to wrap resources and support around our nurses. The website describes a host of resources and opportunities to connect with other nurses. They include, as you can see on the screen, tools and apps, printables, assessment tools, podcasts, and connection. And although this is directed towards nurses, lessons learned and the resources can be widely applied throughout all of healthcare. Next slide, please. So the time is now, really shifting from a transactional employment to more of a transformational growth in our workplaces. And that being said, I really would love to connect with anybody that wants to have further discussion. So if we could launch that second polling question, Mary. And my ask is if anyone is interested in a separate 1 hour special session to connect with peers and be able to do some breakout sessions, or at least some more interactive dialogue around things that are working. We're unique in our region that we're all pretty rural, and there might be lessons learned that we can share amongst each other to help streamline some of this change as we move forward. We'll give it just 5 more seconds, and then we'll go ahead and end it. Okay, Mary, we'll go ahead and end it there. I want to leave enough time for Kyla here. So thank you for your time and your attention today. If you indicated that you'd be interested in a special session to explore this a little bit more, please reach out to me. I'm going to go ahead and put my email in chat while Kyla is presenting. And with that, I'll turn it over to Kyla.
Thanks, Emily. I do want to note there was one comment in the chat about for nursing, tangible proof of organizational just culture is becoming a new need. And we had others agreeing with that. Lori, did you want to come off mute and elaborate on that, or?
Sure. As we're facing a large potential walkout on May 12th, as probably many of you are aware, and a lot of that is surrounded the recent criminal investigation / convictions of nurses for things that are not typically done. Silver Dawn Devat, that case is particularly brought national attention. There's a few others that have occurred recently within the last few months, and so nurses are scared. Nurses aren't, and when our organizations aren't stepping up to support them, it's an issue. And so I think for the profession, that's a need that an organization needs to recognize and work with staff, because if we don't have just culture, we've already seen that nurses are changing their practice, and I'm afraid that will result in less reporting. So if they make a med error, they're not going to report it. And we all know the downstream effects from that. That's why just culture was instituted a few decades ago. So I think reaffirming that would be important to demonstrate value of the nursing profession.
Thank you so much for sharing that, Lori. And I also see somebody that stated stay interviews as opposed to exit interviews can help get employee input on how organizations can help them. So I love that idea. So if anything else comes up, just throw it in chat and we will have a little bit of time for Q&A at the end. I'm going to talk about the new recommendations for second boosters that came out from the CDC. I think it was around the first week in March, and the updates they've made to those since that time. Next slide, please, Mary. So basically they came out and said there's basically two groups that were eligible to get a second booster. Those people 50 and older, and those who have immunocompromising conditions. And those boosters are recommended, that second booster recommendation was made to be 4 months after the first booster. And just to note, on the boosters, the only two boosters that are recommended for second booster are Pfizer and Moderna. They are not recommending a second booster of J&J at this time. And that kind of goes along with what the CDC had previously recommended, where they said the mRNA vaccines were preferential for those first booster doses. Next slide, please. So then after they had made that recommendation for the second booster, they updated it last week after the ACIP had a clinical advisory meeting with all of their advisors, and kind of updated a couple things and said, hey, there might be some additional considerations that we need to look at in these groups. And so they basically gave us these considerations that might additionally support the decision to get a second booster for patients. And then they also updated the guidance for folks that had had a COVID infection in the last 90 days. Next slide, please. So basically they preface this as saying this is an option for people, and really it needs to be a decision between the patient and the provider, using clinical judgment and patient preferences as to whether some of these folks need to get a second booster at that 4-month mark. And another note was, and this question I believe came up in one of our calls previously, you are not required to have that second booster to be considered up to date at this time. Next slide, please. So these were the main considerations that they put out. Basically, folks that have are at higher risk because of underlying medical conditions. And this is a list that I've that I have posted in my resources slide, if you're wondering, what are the higher risk underlying medical conditions? And then folks that are living with someone who's immunocompromised. So they've already recommended for people that are immunocompromised, but people that live with them or someone who cannot be vaccinated should consider, if they live with someone or someone that's immunocompromised, they should consider that second booster. People that are increased risk because of their occupation, or if they work in an institutional setting and they might be a little bit at higher risk for exposure to COVID. And then they also put in there this community level kind of threshold. So if they're in a community that's at medium or high level at this time, which is another link that's in our resource slide, you can actually go there, type in your zip code, and it will tell you what the level of your community is at this time. Next slide, please. So they said also, here's some people that might want to wait on getting their vaccine. And it's basically anybody who has had COVID in the last 3 months, or that feels like, I'm not sure the rates are high enough in my community right now. And what if we have to get another booster in the fall when the rates go up? What's going to happen with new variants? What's going to happen potentially if they're developing an updated vaccine to cover these variants? So just kind of made it pretty open-ended as far as whether folks should get their second booster or not. So it's going to be an individualized decision, like I said, between the patient and the healthcare provider based on multiple factors. Next slide, please. And just to clarify, their recommendation to wait after you've had COVID is for that first and second booster dose, not just the second dose. So that would be a consideration in both cases. Next slide, please. And then one other thing, just to update something that's changed since we last talked about the therapeutics that are available for COVID treatment. They did remove the emergency use authorization for one of the monoclonal antibodies after they found it was not effective against the BA.2 variant, and that's sotrovimab. So that is no longer recommended as a therapy at this time. I have a question in the chat. It doesn't appear they're recommending to use same brand as original series booster. Thoughts? Yeah, it's still the mix and match like they recommended with the first dose. And they did say specifically they're recommending Moderna or Pfizer. I think either one clinically seems like it would be a good option, unless somebody had like a severe reaction. They might want to consider getting the other mRNA vaccine. Does that answer your question? And then one other thing that I did want to mention that came across my radar was the fact that they are working on a combo vaccine that's going to be COVID and flu. And this has been in the pipeline for a while, so you've probably heard about it. They did come out with preliminary results that said it was effective, and they are going to be starting their phase 2 trials on that. It comes from a company called Novavax, and they are going to be starting those trials near the end of 2022. So we'll see what happens with that vaccine. Novavax does have a COVID vaccine that is licensed for use in Canada, and I believe maybe some other European nations, but we don't currently have one in the US. But that is something that's coming down the pipeline, just to keep an eye out for. Questions?
Well,
Maybe
thanks, Kyla.
Maybe I should have had some polling questions. No,
Well,
thank you all for having me. And I think Emily will wrap us up.
Yeah, again, I did put my email in the chat. Would love to hear from those of you that said you would be interested in a special session. And we do have the evaluation link in chat as well. Next week, we're going to have Trish Gardner from the Montana Immunization Unit discussing vaccine access and immunization, as well as cohorting best practice ideas led by Montana's HAI, Erica Baldry. So we hope you join us then. Thanks for your time.